Hey everyone, so we'll be doing threads today. I'm going to be doing them around the eyes and they're going to be 12 millimeters. I get my threads in Fuller House. They've been wonderful. But the second thing I want to say is I don't recommend anybody to do this procedure, and you should always go to a professional. I myself have my own medical background. I have my own studies. I feel comfortable enough. That doesn't mean that I recommend absolutely anybody to do this. So the first thing that I'm going to do is I'm going to use a lidocaine that I get from Filler House that is 10.5% lidocaine, so it's pretty strong. I'm gonna grab a spoon and I'm gonna start rubbing it around the eyes. And the other place that I'm gonna be doing it is gonna be, I'm gonna put a few threads above the eyelid and below the eyebrow. That's it. And that's gonna also give a little bit of a lift and a little bit of a cat eye. So I'm very excited, and I'm gonna leave the lidocaine for about 30 minutes, and then I'll come back and we'll start. Okay, so we're gonna put the first one. The first thing is to see where the bevel is. Bevel and the top needs to be down, bevel down. So this is the bevel that is gonna go down. I'm gonna go very gently and slow. I don't want to hit a vein. I don't want to have a bruise. So that's why I'm just going super slow, because if I get stopped, I stop myself. And that I found that it helps to prevent bruising. So slower in this case is faster. That's the first one. Now, I like to take them out right away. They say that it's better to leave them for coagulation. However, to be honest, I'm going to take it out because it's not the way I do it. Because what I found is that if it hits, in fact, if it actually hits a vein, then I'm just talking about me, if I keep the thread inside, the needle inside, it gets bigger, the bruise. But that's me, you know? So I'm gonna turn it counterclockwise. Hold on, there is a tiny piece left. And I wanna make sure, there you go, that there is no thread left. Good. So, trying to get some of the wrinkles here, a little bit in my frown lines. Going very slow. Turn it counterclockwise. The stopper, I'm gonna put my finger, take it out. Okay, so far so good. No bruising, no major bleeding, nothing. Again, bevel down. Sometimes these tiny needles are kind of hard to see where the bevel is. Okay. And same thing, I'm gonna go really slow because I don't want to hit a vein. I don't know if you can see that there is some left of the needle. I don't want to have anything left. There you go. Turn it, grab it, out. Now, thread is in. Gonna need to put some threads here soon because I'm wrinkling up quite a bit there. Okay. And I'm gonna start going up. I'm just gonna put about 5 down underneath, and I'm gonna grab the skin a little bit so I can insert it and go slow, go slow. There's a little tiny left, very tiny. There you go. Turn it. And it's out. Okay. My friend here, Oksana, is helping with the filming. She's a pro. All right, let's do one more. I'm trying to lift the eyebrow a little bit because it's, and to give a little bit of a cat look too. Okay, hold on, bevel down, there you go. All right. Oh, and I use a band, a hair band, to make sure that there is no hair that comes underneath, because you have to be super sterile for this. Everything is sterilized. Before I did the threads, I cleansed my face with alcohol. Oh, I got a bruise. I got a bruise. Okay, there's a little bit of bleeding, and I'm gonna get a bruise there. So, podemos cortar up. Okay, so a nice bruise here. So I'm possibly going to be bruised up for like a week. I'm gonna take some arnica, that's gonna help me. I did take some arnica before. I do recommend, guys, to take some arnica. Homeopathic pills are wonderful for prevention of bruising and inflammation, and you know, this bruise could have been a lot worse if I didn't take the arnica. I have tried taking it and not taking it, and it does make a difference. And I did put some eyes. So, all right, we're gonna go to the other eye. This is all clean and sterilized. The first thing is to see that the bevel is down. Sometimes it's hard to see. Okay. And same thing, we're just gonna go super gentle. I'm not gonna force anything. I'm gonna be inserting the needle very softly, very gentle, without rushing. Turn it counterclockwise. Press out. That's the first one. Second one. I'm gonna put 3 or 4, not many. So basically what the threads are gonna do is they're going to plump that area a little bit, because my eyes tend to go in, like this area tend to go in a lot. And since I've been doing the threads, I can see my eyes a lot better without seeing a shadow underneath the lower eyelid. Every picture, it was, you couldn't even see my eyes, so it's a big difference. Okay, we're gonna do one surrounding the crown lines. Now, this is not a lot, believe it or not. You know, I've seen people putting like 10, 20 in one eye. I go conservative. I build my things little by little. I like to do things in a conservative way. When it comes to DIY, of course, there is always risks. I'm running the risk of infection. I mean, any time that we insert anything, this is why it's so important to keep everything sterilized. Very important. Have a headband or something so nothing gets in the way. Okay, we're gonna do one more, lifting the eyelid a little bit. All right. Very slow. Good. Turn it counterclockwise, press. Good. And that's it. So this will lift my eyes a little bit, plump this area a little bit, and then also plump this area right here. And my next move is gonna add some PDO or screws. I haven't made a decision yet. In this area that tends to get more wrinkle than this area. Thank you.